pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And I mean for all.
Welcome to Lake District. Our first item on the agenda is public comment.
Mr. Chair, I'm wondering if we couldn't move public comment until after Prehan's presentation. I think the public might have more of an informed comment after that.
Okay.
Absolutely true.
Absolutely.
We can do that.
Thank you.
Thank you.
We'll wait for Prahan's financial report and then we'll go to public comment if that's okay with the board.
Sure, fine.
Okay. With that, we move to approval of the consent agenda. Has everybody had a chance to read the minutes?
Yep.
And we've got the calendar signing for September. First time I don't have to sign in for a long time.
Did you get the revised minutes?
The ones we passed out.
Yeah.
Okay.
Okay.
Well, we emailed them, but I didn't know if you had a chance to see.
Okay. With that, approval of the consent agenda.
I so move we accept the consent agenda. Second.
Okay, been moved and seconded to approve the consent agenda. All in favor?
Aye.
Aye. Passes unanimously. Okay, well, we're moving right along. It's Prahan now. Prahan is our new Chief Financial Officer, so I'd like to introduce him to you. He's coming highly recommended, and he's got some ideas for us. So, Prahan?
Thank you. Thanks very much. Good evening, everyone. Charlie, members of the board, every one of you who is here, part of our team and the part of the Lakeview community. It's a pleasure to be here. Just a few words about myself. Born in Sri Lanka, a small island off the coast of India. This is my 40th year in the United States. My background is in healthcare finance. That's what I know. I'm a certified public accountant and a certified internal auditor and a fraud examiner by profession. Much of my work is centered around hospital-affiliated and independent physician practices. Can you hear me? Everybody okay? All right. Yes. Yes. Great. Thank you.
To the corner here, and maybe like.
Yeah. This is okay.
Like right to
Maybe
the
come
corner.
down a little.
Oh, yeah, I can do that. I can do that very well.
Yeah.
Right. So happy to be here and looking forward to working with the board and with Charlie and the clinical and non-clinical team at the hospital, and meet with you hopefully more than once a month. And I wanted to do an initial presentation of where we are and what we will do in the next 90 days. That's where we are. Now if you look at the financial statement, you'll see that. In the next few minutes, we'll go through the financial statement. When we understand this, when we'll go through these numbers, for the most part, things are pretty much in order. There is nothing significantly unusual about the way we build the revenue, we build the visits. There are 2 or 3 areas that requires conscientious monitoring, and that's what we have committed to do. In terms of saying, how do we bill and collect? That is in everybody's mind, which is called revenue cycle management. And we will be very, very, very careful about how we go about doing that. Awareness, there are certain challenges which are inherent in the way rural health is built. Access to doctors, access to nurses, and in the absence of not getting them when we want to, then we go to agencies who provide them at exorbitant rates. And that's a challenge. That is an inherent challenge itself that we need to overcome. So we will make a very active effort to recruit more doctors and more RNs into the district. That if you were to ask me about Prahan, can you give us the top 3 challenges? That's one of them. The second challenge is the revenue cycle management itself. The third, is, and then these are things that I've already shared with Charlie and I've also shared with the board, so it's a very open conversation. So whatever I'm sharing with you is what everybody else is aware of. And at the end of this conversation, this presentation to you, I will also make certain commitments that I have made and I'll make it pretty public so that you're aware of this as well. So the third aspect is also relating to administrative and operational management, a bit better scrutiny on this, how we manage them on a day-to-day basis. Top 3 things. So beyond that, we have other areas in terms of expenses, especially recruitment expenses. When it starts to go up, we have to be more conscientious about how we spend. So conscientious spending, and so I
Recording in progress.
now? Right? And you're not going to ask me to restart.
Start over.
I could do it in another language, so it have to be fun.
Yeah.
So, I just want to make sure that each of us know certain things when it comes to any business. We just have to be careful about how we monitor our expenses. Conscientious spending is absolutely essential the way we do this. Well, not necessarily in the hospital, in our homes as well. We may have the best of collection of handbags and shoes and everything else, but when your spouse comes and says, honey, we got $1,500 in our bank account, now we're listening. That you can associate, everybody can relate to that. You can have a donut shop, but if from the time you sell the donut till to receiving the donuts, if you're taking 3 months to collect the funds, you can bet that donut shop is not going to be around for too long. That is not a very novel idea that I'm sharing with you. It's pretty common sense. So we just have to be very tough on that, and that we are going to be. So one of the challenges that Charlie would have shared and throughout the last few months is that, and that will be revealed in the, if you go, let me go through the financial statements. I'll share each one of these, okay? Let me spend a few minutes. Can you please take us through that? These numbers, when you look at them, and I said, a lot of what is happening is in the right direction. Our visits are increasing. Our revenues are increasing. We have a few things to look in terms of why is our adjustment so high, and that's because of different insurance contracts. We'll be reviewing them very carefully. You go through this route, everything else, until it gets into certain areas that we need to be very, very careful about, and that I will. How much time does it take for us to bill and collect? The average is between 35 and 40 days. It's taking for about 98 days for us. So we're going to, I'll address that in a minute. How much cash do we have? That's another area. That's what it's very black and white. If you go through this, everything that you see there is it's a very transparent process. You go into gross revenue direction. This is very routine. Could you please get to the number of days?
The cash on hand, yeah.
Collections? Yeah, days cash. Yeah, there you go. If you look at that, how much? What does that tell you? These are numbers that we look for a few seconds, and I don't expect it. That's what it tells us. How much money do we have in hand to run the business? Right? Right now, we have 16 days. So, what does that mean? We're going paycheck to paycheck. We will change that. And that's a very strong commitment. But I met with every member of my team, at least the directors. And I'm very grateful to Tori and Charlie and everybody else who gave me that opportunity to say, Prahan, go meet with them. It's a very open structure. Charlie has been absolutely transparent with me and said, go meet with everybody that you want. So I started with Tori to meet with all her clinical team. And I started to meet with the admin side of it, revenue cycle management. At the end of which, I'm still going to, I'll give you my concluding remarks. This, we cannot sustain this. So we're going to change that. Can you take us to the number of days in the year? I think revenue, maybe it's more. Tasha, is days in the year is in there, right? 89 days, something? It's not in there? Okay, all right. So again, days in accounts receivable means how long does it take for us to bill and collect? If I came into the hospital and there was a visit and let's say there's $1,500 as a charge, how long does it take for us to bill and collect that? As I said, the average is about 40 days, between 33 and 40 days. Ours is about 2.5 times that, and we will fix that. So if you fix that, and when we fix that, when this will also get better. That means we are collecting more frequently, you'll have more cash available, more funds available. So if you look at the challenges facing us, you can break it down into 3. One is most external, but it has an internal impact. That is the availability of doctors and nurses for us to have care. They develop the visits, right? Secondly is how good are we at billing and collecting? How efficient do we become at that? And that right now is about 98 days. Thirdly is the number of how many days worth of funds do we have at any given time. So I met with the board of directors, met with Charlie, and this is the conclusion. I want to make sure that everybody is aware of this. I have made a 90-day commitment to the hospital. And that is, I will take that 96 days or 98 days, bring it down to 40 in 90 days. The next 3 months, I will bring that down, that it takes about 40 days for us to bill and collect our revenues. Secondly, the days in cash, 16, that's not what we want. We want at least between 60 to at least 2 months worth of cash. So I need to get it to 60 days. Quantitatively, those are the 2 quantitative goals I have committed to the board, I have committed to the CEO, and I'm committing to you. The number 1 commitment is to keep the hospital for the community. There is no doubt in our minds. Collectively and individually, we are committed to that. And that we will accomplish. And as time goes, and you will see better performances, you will see constructive development of this in the next month after month, but there are certain quantitative goals that I have committed for 90 days. The second aspect is related to that is efficiency, cost efficiencies. We will seriously look at our staffing ratios and staffing levels. Some staff cuts are inevitable, and because we just can't function like this. We cannot have expenses continuously more than our revenue. It just doesn't make sense. So some staffing levels, some staff cuts are inevitable, and we will carefully scrutinize that as we look forward. That's my presentation today. It is a pleasure to be with each one of you, and we're very committed to where we're going with this. Questions?
I have a question.
Yes, ma'am.
My name's Marianne, I'm a clinic biller,
Yeah.
and so your commitment is to move all of our jobs to India, is that what I'm understanding?
That is not correct. That is not my commitment at all. There
I
are.
keep hearing I'm going down the road.
Yeah, no, that's not down. Well, there's a point about this is that there are times when our resources aren't sufficient enough. We need to get adequate amount of resources to cover all the work that needs to be done. Those are done remotely, And that can be done. Right now, we are no strangers to remote services. Several of our staff don't come to work. Whether it's India or Timbuktu has no relevance to it.
I'm at work every day.
I'm not referring to you. I'm not referring to you. You know that. The important thing is it goes beyond one single individual. Our focus is to keep the hospital available for the community. And I want each of us to understand what that means. For the next 100 miles, we have one hospital that's available, and we are going to keep it that way. We are committed to working to ensure that the hospital and its care is available for the community. That is our number one priority. Let's please always remember that. Remember, even small segments of it closing, you know the amount of difficulty that the community is going through. We are quickly building a very strong rural health clinic, which will be the gateway to the hospital. And we have Charlie and his clinical team are very committed to building a strong clinical team as well.
Could you perhaps though stop for a minute to show our year-end numbers so the community knows where we're at from a profit and loss?
Yes. So when you look at it from this is our net result. We are 2,912,000 at a loss for the year. And we thought we will have 1,370,000 in revenue, net income. Instead, we are 2,912,000 at a loss. And that's although our revenues continue to increase, but expenses, and that's the point that I was getting at in the first place. Out of control expenses, some of which we don't have control over. The expenses that we have to do because of, what's the right word, Charlie?
Contract labor.
Contract labor. Thank you, Charlie. Contract labor is killing us. That is why Charlie and with the support of the board, we are committed fully into the recruitment of doctors and nurses. It's absolutely important. That is, if we only had 3 doctors and 9 nurses that we are looking for, we'll be in a different place. But with rural environment, that is an inherent problem that we have, getting doctors and nurses the way we want to. So instead we go to these contracting agencies who then provide these nurses about 250% more than what the average rate is. So when we look at hospitals, and that's the real fact. That's a very important, very real fact in terms of what is some of the challenges. I'm not at all diminishing or playing less about our challenges in revenue cycle management. That's real, and that I am taking control over that. I'm taking direct responsibility for that going forward. But this is a very market-related problem every rural hospital faces across the United States. Yes, ma'am.
I disagree with your response to this lady here, because she may be one person, but one and one make many people who are going to be out of work, and you can't diminish her concern for being here every day, being local, and yet you have to go outside and pick contract nurses. So I think your response to her is inappropriate at the very least.
Thank you for telling me that. Contract nurses is a different scenario, madam. Contract nurses are not available here, so therefore we have to contract with nurses that are from other areas. Yes, ma'am.
I think that it would be time consuming and it would probably be difficult for you to do, but if you were to go back and interview people who were longtime employees, doctors that we have lost within the last 8 to 10 years, and find out why they quit, why they won't come to work for the hospital, I think that you would get a substantial amount of information, and you would find out why the workforce here is not really available. But I think that sometimes you have to go outside the doors to find out what's really going on.
I agree with you. One of the things that I enjoy is that to go out and actually speak to different people, people have different opinions and different concerns which are very
I
valid.
would really encourage you to get a hold of past doctors that were here, that left. I think they would give you a lot of information
Thank
as
you.
to why we are in the situation that we're in.
Thanks very much indeed. I will certainly do that. Thank you. Thank you. Yes, every support I get, every idea, all ideas are welcome. I may not be in a place to put all of them in place at very quickly, but I welcome that. Two hands went up. Yes, ma'am.
So, just plain blunt, how many employees are you gonna lose during this? How many people are you gonna lay off? Just plain blunt. Are you laying people off?
Excuse me, we're not here for a debate.
No, I'm not debating, I'm asking a question.
Public comment is great. He's
It's a
brand new.
question, Don.
Let the work go forward.
Well,
So,
It's a legitimate question, people wanna know, are they gonna have a job tomorrow?
Oh, it's a very legitimate question, and at the same time, I also want to know that right now our priority is to actually get revenue cycle management in place. Right now, our priority is that, and we will focus on that. In doing so, there may be some layoffs. I don't have a number on that now. Yes, you had a.
I often wonder, my contact with staff is primarily nurses, aides over at the Gardens.
Yes.
And there were a lot of contracted employees who made a huge amount of money in comparison to the local residents who were aides. And I often wondered, and you gave the statistic that for a contracted nurse, it's $250.
Up to that, yeah, it goes in that range,
So
yeah.
has there ever been any value into raising the salary of local people who live here, who are committed, and would that be I don't know.
Ma'am, what we are running out is actually the number of nurses needed. We need more staff to be able to do that, and then what she said is a good suggestion. I will certainly seek, and then try to understand.
If we paid local people, not as much as a contracted nurse, but more, wouldn't that give them the incentive to stick around?
That was definitely a point of contention as to why several nurses and staff no longer work here.
Okay.
I always wondered that.
Thank you. Thanks for sharing. I'll certainly learn more. Yes?
I also work in the billing department, and I have questions about the outsource company. I would like to know how long they are going to be contracted with the hospital.
It's a temporary contract, and we have a very specific target in mind. Once it's accomplished, the contract will be over.
So how long is that contract?
I have no idea at this time. It's until
So
we,
then, why did I see an email that said it was for 1 year, and then when that year is over, it is automatically renewed for another year?
I don't have signed anything to that effect at all. I think I've signed, if at all, for 60 days.
Okay, so then my next question is how much a month are we spending on this contract?
Oh, at this time, it's way, way less than what we spend here. It's less than 50%. In terms, if you're going to compare expenses, it's way less than 50% of what we're spending.
But that's still not a number. Is that like 30,000 a month, 40,000 a month?
No, it's based on performance. It's based on performance, it's less than 50% at current levels.
So is the performance on
I think we're getting
everything
way
they
far
touch?
No,
into
Don,
it.
you sit down, okay? He is creating a hostile work environment in the billing department. He is trying to impose quotas on us. He is making us feel like if we don't outperform this outsourced company, we are getting fired, we are getting laid off. It is not fair to this billing department who has been holding our heads up and swimming upstream when we have a guy that consistently spends more than we bring in? How is that fair to us to get the blame when we are not properly trained? I am the only one that I know of in our billing department that is nationally certified in billing and coding. And when we ask our boss about it, she's like, oh, you don't need education. You just learn on the job. I've had less than 40 hours of training as a billing person alone. And then they're like, oh, that's okay, you can just learn like the rest of us. Like, that is the mentality in the billing department that needs to change. We need more people brought in to train us to be better, not outsource it to a company in India.
We can't address those, but we want to work together with you. You're not fired.
Yeah.
but that's what I
feel like.
The thing is, we're working hard going forward. We're looking at a situation that is untenable in the past, and we're working at ways and means of getting that back under control.
Get rid of Charlie and that solves 90% of
Right now
it.
is going to help us get our cash back under control, and let's work with Prahan and see what sort of training we can get to make the whole building department.
I just want to
That's
know,
what Prahan wants
it was
to
not,
do.
you need to just be clarified that I never said anything about training. That's not, you're not referring to me when you said that.
No,
Right.
no.
Yes, I want-
I'm not.
Yeah,
But
I want to make sure about.
every time
Secondly,
any one of us say we need more training, it gets shoved under the rug and we don't exist.
I'm glad you brought it up, man, but that is before my time. So you need to address that going forward. I just want to be in front of each one of you going forward. I want to also please let you know, each one of this situation, the way it is not, we cannot proceed with this. Please
We
understand.
wholeheartedly agree to you,
Yeah.
with what you're saying, that we're not the ones spending the money.
No, not at all. I have no intention of trying to put blame on any single person. That is not
You and I
my,
had the conversation about
yeah,
how
I mean,
come it didn't matter how much we brought in, there was always $1 million more than what we brought in that was spent. Whether we made $1.5 million, 2.4,
and
$1
yes,
million more than what we brought in every month was spent.
I want to please,
And I'm sorry, you're really being put on the hot seat. You're either gonna love us or hate us.
no, I want to please be aware about all this. I just want you all to be, as much as I want to be straightforward with you, I also want a fair play in this and saying, look, you can go back and talk about everything that's happened in the past, and I'm not going to. I'm not here you're not going to tempt me into this. I'm not going to walk into that phase at all. I'm not going to go start walking and saying, blaming A, B, C, D, and E from the past for this. All I'm saying is going forward, what needs to be done to keep this hospital. That is our number one priority, and what is happening relating to one or two staff or beyond that staff is something I'll work with each one of you. And that is all I can make that commitment. Now, number one priority is to get revenue cycle management fixed, and that we will. I am taking on the lead to do that. And I am inviting every one of you to join me in that. I have no prejudice or I have not made any commitment anywhere else. But work needed to be done. And not needed to be, needs to be done every day. Every day, a certain amount of work needs to be done, without which we will not be able to continue to provide services. And that's all. I just want to respectfully make that commitment to each one of you and say, I'm here to work with you. Any more hands going up? No? Yes, ma'am.
Well, I just have a simple question. Are you working departmentally by departmentally and meeting with all the people in this department to find out how you can do this? Or is it a mandate from on top that it has to be done? I think that's what I'm hearing.
Oh, no. Well, I'm so glad you asked me that question. Thank you for asking me that question, because I want to say members of the board and Charlie have not put any mandate on me.
Okay.
They only said, actually Charlie has encouraged me to meet with every department.
Mm-hmm.
Every single department, cost versus clinical versus services, today I met with dietary,
Okay.
right? So every
Because I
sin-
think that's what people are asking.
No,
Uh,
yeah, that
If
is,
you're meeting by department, and people will have input.
every one of them, as I told you, today I met with dietary, yesterday I met with EMS, right? And then I think yesterday afternoon I met with Quentin and his team, which is housekeeping and everybody else.
Thank you.
So it is a very system, and this man helped me to get there. Supported by the board, they said, Prahan, go for it. Go meet with every one of them before you have, so that you have an informed opinion, right? You're actually seeing is believing, rather than, I've not been a CFO in my office. I've been a walking CFO. And I intend to do that. That journey is not far from over. I am just about 20% into it. There'll be a lot more I will speak. Yes, ma'am.
Were you involved in the decision to close Lakeview Gardens?
No, ma'am. That was before my time.
You weren't involved at all? You didn't give any advice at all?
Before my time.
And do you agree with it?
If Charlie and the board did that,
No, I'm not asking about Charlie, I'm asking about you. Do you agree with it?
the decision always will be cost-based, whether we can afford to continue to provide services. Once we make a commitment to provide patient care, do we have the resources and is it long-term enough to care for them? Patient care will always take precedence over anything else. And that is what Charlie and the board of directors have done that. And I stand by their decision to do that.
I think that should end our public comment period.
Okay? All right.
Thank you very much.
You're very welcome. Thank you.
Okay. Our next item on the agenda is the Goose Lake backhoe.
Sorry, Don, we couldn't hear what you said.
Hear what I said? The next item on the agenda is Goose Lake Medical Services. It's the financial report for Goose Lake,
And that's MoDOT?
which includes Lakeview Gardens.
Okay.
All right, so Ron asked me to talk a little bit about Goose Lake. This is since our year ended June 30, as you can see, and if you can't see it, I'll read it from the back. We had $205,000 in revenue in the month of June, and it was split out between long-term care and assisted living. And we had expenses of $400,000. So we had a loss of $195,000 for the month. And for the year, we lost $1,671,000 in long-term care. Might note that we spent $991,000 in traveler cost, contract labor. It's a very difficult situation where we cannot find employees to work, and we have to rely on contract labor. Next.
Questions? Comments? The next item is the medical
Medical supply.
staff, right?
Well, I was going to finish with Lakeview.
One more slide.
This is our medical supply company. We had revenue after deductions of almost $46,000, and expenses of almost $35,000 for a profit of $11,000. It's not really profit, it's net income. For the year, we ended out almost $126,000. A good year. And we are actively working with a consultant to help us get contracts that we have not been able to provide services to. So that should be able to enable us to offer more services.
What kind of contracts would that be, Charlie?
So the medical supply company is predominantly in the oxygen business. It provides wheelchairs, it provides beds, it provides other kinds of services, but predominantly people that need to have oxygen. Much of our business is in Oregon, but California, we also have a lot of patients that come up to our sleep lab get services. The Blue Cross for Oregon is Regions. The Blue Cross for California, Northern California, is Anthem. And so Anthem Blue Cross has not been willing to give us a contract. We're trying to get a contract with Anthem Blue Cross. And they say they're interested, but they haven't acted very quickly. Does that answer your question?
It does.
Any other questions about Lakeview Gardens?
Next would be the medical staff report, but I jumped too quickly. Dr. Graham?
Dr. Graham was here. He had to step out. He is covering the emergency room, so I don't believe he had a report this evening. So,
Okay. In the absence of Dr. Graham, we'll move on to the nursing report. Tori, you're on.
Okay, holding steady, basically staffing wise as to where we were. Recruitment is hard. I have not been able to hire any more nurses. We are using contract labor. I'm keeping that as minimal as possible to make sure that we have enough staff to care for the patients safely and to make sure we can admit patients to the hospital to care for them. Other than that, we got through the internet outage well. Nurses and staff were great about just being accommodating and flexible and creative in providing care during that time. And our patient satisfaction scores continue to go up. So that's what I have to tell you tonight.
That's a dedicated staff. We thank you for that.
Tori, you said it, was that maybe last month, that you had 12 openings for RNs. Is that where you're still at?
Yes,
You could hire
12
12?
RNs, yeah.
full-time.
And how's our classes going with the CNAs and the nursing classes?
The CNA class is finishing early next week. They've all done very well. They've been very helpful on the
How
board.
many is in that group?
There are 6, I believe. The RN classes start late September, and we'll have 2 second-year students. The program's 2 years long, and we'll have 3 first-year students. And they will be attending full-time, 2 days on the floor and 2 days of classroom time.
And it takes 2 years to get to RN?
Yes. They could become an LPN after the first year, and both of the first-year students will work as LPNs.
Okay.
Yes, while they go through their second year to get the RN.
And they're using the scholarship program?
I don't believe in the first year the 2 are not. In the other class, I believe there is more potential for that, though I can't speak to whether it's in place yet.
Okay. Thank you, Tori.
You're welcome.
Any questions? Okay. Manager reports. So, Tyson or Clinton?
I don't think I have any new information. I think that my teams also did a very resilient job of making it through the internet outage. We were able to pretty much do business as usual, less impacted with the environmental services team, but the supply chain team was very resourceful. And so there were no hiccups in supply deliveries or ordering. And the DME is doing great work, so that's my report.
Thank you.
EMS had a pretty busy month. We ran 56 calls with 7 of those being transfers out of town. 3 to Bend, 1 to Klamath, and then 3 flights. The crew did a great job of covering. We had multiple times where we had back-to-back calls, so thankful for the staff that we have.
Are you staffed out?
No, we're still down 2.
We're still finding places for residents. The internet outage for us
wasn't, it was no big issue. I mean, we're used to making do with what we have, so, and making things work, turn things into something that was not what it was originally for, so. We're used to that, so it didn't really faze us much.
Thank you. Did I miss anyone else back there?
Can I know I'm only just a citizen, but I also work at the clinic and I don't hear any report for the clinic. She's out, and I know that.
She's out. That's why we're not having that report.
But
Nor
can
from
I
HR.
give a little information?
Sure.
Because we did do our attestation to keep our level 4 tier, which is a good thing. Something else that we found out while doing this is that there's ways that we can improve in maybe some charting, some other ways of making sure that we're able to bill at a more accurate level.
Okay.
So I just wanted, the clinic is really doing their part. I just don't hear, I just don't like us to be shoved in the corner and left alone.
Oh, okay. And you're working with Prahan with this, correct?
Yes.
Yeah, I just want to make sure that every one of them, the clinic is an integral part of the system. Clinic is the face of patients and referrals and patients, the referrals to the hospital, patients using our lab and radiology. I'm a big campaigner of the clinic. So I just want you to know that. Thank you. Thanks. I also want to probably just take 1 minute, please, and thank my team, each one of them who have made this my new entry into Lakeview, and from a professional point of view, from Charlie to the clinical people, to Tasha, to everybody else. Thank you so very much. And Shirley, I hope she's on there as well. To have an objective and a very knowledgeable Director of Human Resources is a tremendous plus, and I appreciate that a lot. Thank you so very much to each of you.
Thank you. Next on the agenda is our CEO report.
So a couple things. We continue to work, as Mickey said, on the process of closing down the Lakeview Gardens. The process is not always easy. It was difficult last week when we didn't have telephones and internet, but that process is still occurring. And we don't have a definitive date of when. We have a final date that meets the state requirements, but it probably will be less than the September 13th date. Probably sooner than that. Last week was probably the more challenging. I'm glad it wasn't quite as difficult for long-term care, but as Tori said, not having telephones and internet was a big challenge. It's hard to imagine those, when we think about a third of our nurses had never charted on paper. They were so accustomed to using the computers, and that's what we've been using. But when you don't have internet, and you can't access the computers, you have to move to paper. So that was a learning curve. We learned a lot of things in this process. Number one, we have to rely on ourselves. The fact that we were relying on the resources that were going to be coming from the state, they didn't work quite to the level that we thought. So one of the things that we have done is we've acquired a Starlink connection. It's a business connection, and we are testing on how we will make that as a backup to our system. TNet, for those people that have used TNet was able to get a connection through Alturas, and they're working to provide us with a redundant connection so that we don't have this. Now, even if we have a TNet or a Starlink, that doesn't fix the telephone. The telephone was still a huge issue. We're looking at, we've gotten software, we don't know yet how to use it yet, that will take our faxes that come in for orders or when we're sending them out, so that we can use that on a PDF format and figuring out how we're going to make that work. So we've got to find some workarounds to accommodate that. when you don't have internet, one of the things that we found Thursday morning, we should have been up a lot sooner, because internet actually came back, and telephones came back first thing Thursday morning last week. What we found is we have many, many secure systems to protect us from outside hacking. And there was a background software program that wouldn't let anybody get in. We ended up using the Starlink connection to connect one of the laptops, to backdoor in, to turn off that program so that we could access our internal system. One of the challenges that we face when the internet goes down is we have lots of people using their smartphones as hotspots. Guess what? Those don't have the very robust antivirus software that we have for the system. We made ourselves vulnerable to hacking. Now, it wasn't a huge vulnerability, and we have found our systems went back and double-checked everything. Didn't have any breaches, fortunately. So it isn't just not having internet, it's making sure that every part of our connections are secure.
Question. Have we had a chance to test this commercial Starlink satellite? And I guess my question is if it goes out again, and my understanding is in what we're running on now temporarily is just fiber optic laid on the ground until they can get the poles down. So we're one cow getting caught and away from this happening again. But my understanding is getting MRIs read or X-rays read takes a lot of bandwidth for us to send those out and to get them back and stuff. Is this going to be robust enough to allow us to do those kind of things, you know?
Good question. So there's a couple things to understand about how our internet process works. Most people at home, if they get 30 or 60 megabits down and 20, 35 up, that's great for at home, for downloading movies and whatnot. We actually have, our internet connection is in the 500 megabits download and close to that upload. The biggest problem that we have is all of that radiology is actually being sent on a separate or slightly separate format. We're able to get the Starlink to work on the radiology part, but it's not running through our Barracuda and software protection programs. So we're trying to make sure from an engineering standpoint that if we plug it in, we still are protecting the network from any untold hacker. So we can make it work, it's not set yet. And we're testing it. And of course, when we pull the plug on the internet and try to plug in these other sources, that shuts everything down. And bringing those back up, we found that, well, it took us several days just to get one of the programs that we use for monitoring. So it isn't easy when you unplug it and plug it back in. It takes a lot to bring it back up. So we're testing it. We have to test it when not everybody's, when it's not being used, so very early in the morning. Because if it's during the day, that screws up everybody. So we're testing it, trying to make it, because this can't, well, it can happen again. We've had it 3 times in the last year. So we've got to have a better solution.
You've already said that.
So, but we can't fix the telephone. That's aluminum, and it's not an internet program. Yes, some of our phones are what's called VoIP, or voice over internet. But you still have to have the main landlines. And that's like my problem. Any other questions about that mess? Our software company, Cerner, also claimed they got a 5G network. I didn't even know we had 5G in Lakeview, but they're trying to be resourceful and try and offer an alternative because we couldn't use their programs. So we're working on it. It hasn't quite been tested properly. And again, it has to go through these antivirus and protection programs. And you would not believe how much junk we stop that comes in to try and get into our system. It's astounding. We have, when it comes to our home health and hospice, we have a couple things that are in process so that we will be able to deliver virtually the same. When we don't have the hospice service, we can apply to the state and federal government to allow us to deliver home visits through the rural health clinic. We've done that. We have applied for that, and we're waiting on the state to grant us that permission. There's no reason to believe they won't grant us that. That will allow us to continue providing visits to the home. It's not at the same level. It's a little bit different than what home health could do. We also have been approached, and John, maybe you could address what we've heard you've been told about.
Well, we reached out to the Collins McDonald Trust to see if they could help us keep hospice and home health going. And after meeting with Krista and stuff, hospice really doesn't make sense for us. We're just so small because we have to have a chaplain, we have to have a social worker, we have to have an RN, we have all of these hospice rules 24 hours a day, except 7 days a week. And the average census that we have in hospice is 2 people. But, so we went to Collins McDonald and asked them to help us to keep this going, as Charlie said, as an RN Dying with Dignity at Home program will be available. And Collins McDonald has stepped forward and said they will support us for the first 2 years. So we will have home health services, and we will have this traveling nurse end-of-life service in Lake County. And it's thanks to Collins McDonald for stepping up to help us out, so that's really good news.
That's awesome.
They're going to help make up the difference on the services that we can't bill for. Some of the things we can't. Some of them are covered by Medicare that we would be able to provide. And we are making arrangements to have a nurse be able to provide that service. So,
but that's an exciting news. If you see Jerry Evans, tip your hat and tell him thank you. It's going to be very important to keep that.
right. So once we get that approval, we should be able to provide that. We also, as part of our home health services, provided a fair amount of rehabilitation services, PT, in the home. And we are working on making sure that that can be provided also. It may not be through the rural health clinic. Any questions about those 2 programs? That's what I have now.
Okay, thank you. With that, we're going to adjourn to executive.
Wait, public comment is at the end. Those were just questions. I have something to say. Excuse me. My name is Sandra Watts, and I'm a 5th-generation person from this area. So I'm not a foreigner or somebody who's come in. And I'm part of the Friends of Lake Health District, and we sent you a letter on June 18th, begging, pleading for you to stop the closure of Lakeview Gardens and home health. And you sent back a letter we gave you until Monday, and you sent back a letter to us that was in the paper saying that we didn't have anything to do with that. That was Charlie. Charlie decided, because Charlie's got the authority to decide to close the 3 buildings that taxpayers are paying bonds on, that we elected you to look over the home health and hospice and the transitional, or the Lakeview Gardens services. And yet, now we're understanding that Charlie has the authority to do that. I've looked at his job description, I've looked at the Lake Health Board, your governance policies, and I've looked at his employment contract. Nowhere in there does it say that he's got that absolute authority unless you gave him the authority to close those buildings. And that's where we come into our questions that we ask you. Because transparency, and as you know, Oregon is very strict on open meeting law, very strict. But yet the meeting that you had in June 15th, where Charlie made the decision to close the Lakeview Gardens and home health care and hospice, that meeting was closed. The only person other than you elected board members was Ms. Atler, who was she was a board electee, was there. Nobody knew what happened in that meeting. There was no minutes. So we're coming back to you with our questions about how could this happen? Why did you not come to all of us here want to help? Jane got the prison back for Lakeview because the whole community came around to help. That wasn't done here. And these are important, critical patient services for Lakeview and Lake County. The most vulnerable of our people who raised us, people who taught us, people who gave everything so that we could all be here where we are. And now they're in a position where they're essentially helpless, and we're going to make them 97 years old, 95 years old. We're going to make them leave the place where they feel comfortable to search for someplace else. And Charlie said, oh, it's all going very well. That's not who we are. That's not who Lake County people are and Lakeview people are. So again, on behalf of the Friends of the Lake Health District, we are pleading with you to stop this action in closing Lakeview Gardens. Let us get a group of people who have ideas, like Kit was talking about. See if we can raise the salary of nurses because we're not going to do contract. Let us have ideas. Let us look at other cost-saving methods, not for the least. Well, I mean, we all know our grandfathers and grandmothers, and we all have places in our hearts for them. What are we doing to them? Please, we're begging you to reconsider, talk it over in an executive session, and come up with some other ideas rather than having to move Dietta's 97-year-old mother and Jeanette's 95-year-old mother. It's just not fair, and so I'm asking you, please reconsider your decision.
May I follow up? I didn't realize that I thought the comments that you were asking for earlier were pertaining to the financial statement that was being made. I didn't realize it was the general public comments. I won't take a lot of your time, but I do want to follow up and say there isn't a one of us here who has worked with a board, an elected board, an elected district representatives who believes for a minute that the CEO or the manager of the town or whatever it is, that they have the ultimate authority to make the decision that Charlie made, that you report that he made. You, the five of you, are the ultimate responsibility for every decision that gets made here. You're the last one. If you don't like the decision that got made, if you let him make that, then you're responsible for it now. You know, the first board, you know, before Jan and Jane came onto the board, they made that decision, or they participated in that process of Charlie making a decision. But we've asked, and you've had 2 meetings now, today's the second one, since the new board came on, and you have been asked to reconsider what took place, and you haven't done it. And now you own it. You realize that you had an improper public process. You allowed a decision to be made without any discussion from the public whatsoever, even the Goose Lake Medical Services. They didn't get a chance to participate apparently. I don't know what happened at their meeting today, but nobody seems to want to talk about that. But you know, nobody had a chance to say a word, and the decision was just sprung on staff, the community, and here we are. You guys had an improper executive session. It wasn't noticed as an executive session. There was no agenda about what you did, and there are no minutes from what took place, except that we know you were there. We know you were there. And then you go and tell us that Charlie made the decision. You guys let him make the decision, and now you own it, and you're gonna, you know, I don't know what's gonna happen, but it's your decision now. It's not Charlie's. You let Charlie make it. It's your decision. And you guys, you need to be cautious of your public meeting process. You know, I just heard now this evening, I wonder, maybe your structure is different than any that I've been involved with, but your CFO just commented that you've entered into a contract, apparently, to assist with financial services. And probably a good thing to do, but when did you do it?
From India.
From India. I don't care where it's from. It doesn't matter where it's from. But when did that decision get made? It's never been on an agenda. It's not in any of your minutes. But yet a decision has been made to enter into a contract for God knows how much, with God knows who, for God knows how long, to provide services. And it is probably needed, but that is the public process. Your website says you're transparent. You guys operate transparently. Well, that damn sure isn't transparent to me. You know, we just learned this evening. You guys, you gotta get your act together and start having public meetings where you're working for us. You know, you represent the public. And we have a right to know it. You know, the public meeting laws aren't to allow you to meet quietly and secretly and get things done like close the gardens. Your job is to have public meetings, inform the public of what you're doing, and do it openly. You know, sometimes it's difficult. I've been there for 25, 26 years. It's a difficult thing to do at times. But you need to do it, because if you don't, this kind of crap happens. You know, I'm sorry, but you guys own the decision to close the garden. I had some other things I wanted to say too, but I'm wasting my time on this, so next time.
Thank you for your input. I think, okay,
It's just
last
real
comment,
small.
please.
It's real, I won't rant. I just wanted to say, the Lakeview Gardens is closing. My mother's there, she's 97. The comment that it's going well, I just have to disagree a little bit. The care is still great, the atmosphere, and I've never had any concerns about her care. How she's going to get to the place that my sister and I found is becoming a bone of contention. She's 97, she cannot walk, she is a medical transport client, and the first option given was I could drive her to Hillsborough. For those of you that may not know, Hillsborough is about a 7-hour drive. Then I said, absolutely not. How am I supposed to get her in my car? How am I supposed to get her out? She can't walk. Then it was, well, how about if the senior center takes her? And I said, but they don't have any training. They might be CPR certified. And so what I'm asking is, we've cooperated, we have found her a place, she's moving, can she please have the dignity, comfort, and safety of having a medical transport? Ideally with an aide who knows her, so she can get up there. I'll go a day before, get her room ready, so this, which is going to be quite a trauma, I don't use that word loosely, to her, to make it as comfortable as possible. What's the big deal? That's all I have to say. Thank you.
Okay. Well, we're going to adjourn now to executive session. We'll take all of these into consideration that we've brought up. This is not an easy process, and you're looking at people who have thought about this for a long time. we made a mistake maybe at that one meeting. If there's been nothing
It
hidden
was
from
a
anybody.
huge one, Don, you'll pay for it.
Where the hell were you guys? We've been coming since
Okay,
2020.
that's
They have
enough,
been
please.
very open about it, and now the public's pissed off. Where the hell were you guys in 2020?
We just found out in June.
You should have been coming to the
You
board
had
meetings.
me.
We're adjourning to executive session. Thank you
They
very
have
much.
meetings every month.
Under ORS, all the ORS. 192-660, factory contract personnel. Medical staff.
Oh, I see their problem.